New cases of the novel coronavirus hitting records last week in Alabama and also across the country. They remain high.
But at the same time, Lenise, the death rate is dropping. Fox News investigative reporter Brendan Kirby takes us inside the numbers.
Alabama's 7-day average of COVID-19 cases reached an all-time high on Sunday, tracking the national trend. The numbers have raised alarm among health experts and the general public. Behind this concerning trend, though, is a reassuring counter-trend. Fewer people are dying. Over the past 7 days, an average of about 550 Americans have died from the coronavirus each day. Those are levels not seen since March, when the pandemic was just gaining a foothold in the United States.
Our forecasts are best viewed week to week.
Dr. David Rubin, a physician and researcher at Children's Hospital of Philadelphia who studied the coronavirus, has noticed.
There's a note of optimism there. Some of it, I think, is summer related. I don't think we know for sure. But I think asking whether the fatality rate has changed in summer is a really important question. We suspect that respiratory droplets are not as big a component of transmission.
The overall daily deaths numbers has fluctuated more dramatically up and down in Alabama as cases have shot upward. But a closer look at the statistics shows clearly that fewer Alabamians who contract the virus are dying. Deaths over the past 7 days are less than 1% of the infections diagnosed during the prior 14 days. That mortality rate was running nearly 6 times as high in the middle of May.
So here at South,
Dr. Karen Fagan, director of the Division of Pulmonary and Critical Care at USA Health, says part of the reason for the declining rate may come down to the fact that doctors are getting better at treating the disease. She says hospitals have a better understanding of how to prevent patients from needing mechanical ventilators and better treatments using drugs like remdesivir and dexamethasone, arrows healthcare providers didn't have in their quivers 4 months ago.
So we're learning how to ventilate the patients a little bit better, or to avoid ventilating them, because we know once they go on a ventilator, their mortality rate is much higher than if they never get on a ventilator. So we're trying to do that. Every day we're learning about more and more management strategies for the critically ill.
You've already made a big impact.
Dr. Jean Marazzo, the director of infectious diseases at the University of Alabama at Birmingham, points to another possible explanation for why deaths and cases are heading in opposite directions. People younger than 25 account for twice the percentage of COVID-19 cases since the beginning of June as they did before then.
More of these cases are occurring in younger people whom we know, as I said, generally have not only milder cases of the disease, but certainly don't experience the same kind of mortality rates.
But health experts warn against complacency. The young and healthy can spread it to the vulnerable, and with so many new cases, they say it could be only a matter of time before deaths start climbing again. For Fox 10 News, this is Brendan Kirby.